Hello Lovelyyot, it's your girl Nancy. I'm back again with another video. If you are new on this channel, hello, welcome. My name is Nancy. I'm an occupational therapist, and on this channel we talk all things therapy, especially occupational therapy. We talk all things healthcare. We also talk a lot about education as far as college goals and also graduate school goals. I give a lot of different tips and tricks on how to get into school, as well as how to transition from being a student to being a clinician. So please go ahead and subscribe, and I am so glad that you're here. Now, on to today's video. Today's video, we are going to talk about COVID-19 interventions. So now we kind of going through this whole COVID thing. Now a lot of patients are getting readmitted into rehab, and now rehab is about to start for a lot of COVID-19 patients. So I wanted to make this video to give you guys a little tips and tricks on what to do if you have a COVID-19 patient. If you just started working with a COVID-19 patient and you don't know what to do with them, this video is definitely going to help you. So please stay tuned. Now, the first thing on my list, please make sure that you're keeping the patients active. Okay, it increases blood circulations and allows that to help them heal quickly, okay, and faster than if they were just laying down in bed all day long and they're not moving or doing anything like that. Two, moving them will also help with getting their lung capacity increased, getting some oxygen into their lungs, and also getting some carbon dioxide out as well. Because obviously keeping the carbon dioxide in is not good either, and not getting any fresh oxygen in is not good either. So we want to keep them moving and active so they can have this exchange of O2 and carbon dioxide. Okay, the third reason why you want to keep patients active is because if they're laying in bed all day, they're more likely to be in pain from contractures, okay, and they also are more likely to develop bed sores, and you do not want a wound anywhere at all because it takes so long to heal and they hurt. Okay, if they are going to be laying it down, make sure that they are being protected, especially at their pressure points. Okay, another thing that you can do with if the patient have already developed bed sores is definitely giving them a pressure relieving mattress or pressure relieving cushions. If they're going to sit in a wheelchair, make sure the cushion is appropriate. If they're going to be laying in bed, putting the boots on them, elevating their heels, for example, putting their elbows and their back on something more comfortable and more pressure relieving that's not going to cause, so you don't want them to lay on anything solid like a solid foam or anything like that, because that's going to make the sores worse. Okay, so all those different points that get a wound easily, make sure that you're protecting those and move them. Bed positioning schedule is really not that hard. Move them every 2 hours in different planes so that they can relieve some pressure. And it's also going to decondition the patient. You don't want the patient to be deconditioned because therapy is going to be a long road for them, because then we got to build on strength and we got to build on engagement again and all that. So by them moving, it can also keep them a little bit more stronger, so they're not too deconditioned. By doing all of these, you can also prevent secondary illnesses like pneumonia as well. So the second thing on my list was deconditioned and weakness. So if you do have a patient who's already deconditioned and very weak, this is your time as a therapist to increase their strength, obviously. So you want to develop an exercise program for that particular patient. You want to get them up out of bed and move them around, do a lot of passive range of motion, active range of motion, get their arms and legs moving around, get their whole body moving around. Even if they cannot tolerate sitting in a wheelchair, at least get them out of supine, which is basically laying flat, to sit on the edge of the bed for a few minutes at least, just to get some circulation going and to kind of relieve a little bit of pressure for them. This would definitely help with the endurance, as I already mentioned. Engagement in occupations, any kind of occupation, takes strength and a lot of endurance. So by getting them up, getting them moving, even if it's a little bit each time, would definitely definitely help them when it gets time for them to actually engage in daily activities like washing up and dressing up and things of that sort. So the next one on my list, contractures. If you have a patient who already have developed some contractures, or they may be on their way to developing contractures, you definitely want to start active range of motion and passive range of motion. Contractures hurt. Okay, being in a static position, like even something like this for a long period of time, is going to start hurting. And even in general, like for example, like was it yesterday or the day before yesterday, I was laying down reading a book or something, and I didn't realize I was laying on my right leg for so long that literally my whole leg started hurting because I was probably laying on an artery or something, and I wasn't getting a lot of blood circulation in that leg. So my leg started hurting really, really bad. I had to stand up and start moving around. So movement is good, and contractions hurt. They are uncomfortable. They are painful, especially if this patient is unable to move by themselves. Okay, just allowing them to do some passive range of motion on them, get that wherever that extremity is moving a little bit more so that they don't develop contractures. If they have already developed, like I said, go ahead and do your passive range of motion on them. And splinting is something that you can definitely think about. If they have already developed a contracture, definitely getting a splint would definitely help. Another thing that you can do for people with contractures is definitely massages. I love giving my patients massages because it really helps with healing. It helps with circulation. It really also helps to kind of iron out your muscles, so to speak. It also decreases a lot of pain. So that's a good one. Therapeutic massages, that is. Okay, if the patient has a weak lungs, breathing exercises is definitely something that you can go for. Okay, and there's so many different breathing exercises. I love the diaphragmatic breathing exercise, and I have a video on this. I'm going to go ahead and leave that link somewhere up here or down below as well, so you guys can watch that video and learn how to do the diaphragmatic breathing. Personally, breathing is also a good one, but it's not as effective as diaphragmatic breathing, honestly. So look at both and do both. I mean, it's gonna work for different patients, so definitely learning those different techniques and having that in your toolbox will definitely help when you have a patient with a weak lung. Okay, another activity that you can do with patients with weak lungs is having them blow a balloon. Okay, this exercise seems so simple, but it's so effective if they are able to do so, because it definitely takes a lot of lung capacity to be able to blow a balloon. I think I blew about like 10 balloons because I was doing a photo shoot, and my lungs were literally suffering. Okay, I need to do some breathing exercises. Okay, and so yes, having them blow on balloons. Okay, and also even if you have like one of those like what do you call it, the blow bubble thing, the bubble things, you can have them blow anything that will have them blow to get some of that carbon dioxide out and getting some oxygen in would definitely help to make your lungs a lot more stronger. Okay, so you're basically exercising the lungs. Another thing that you can work on is definitely the prone intervention. This is something that just started being more popular, but I heard that it's been out there for a long time, but I honestly didn't really know about it. I do know that prone positioning is really good for people who have contractures and developing contractures. A lot of people with neuro diagnosis, prone is really good for them to help prevent them from developing different contractures and stuff like that. So prone intervention, putting them in the prone position, allow them to take in a lot more oxygen. So if you have a patient who is having a hard time to stay above the 90 O2 level, put them in prone position and monitor the oxygen level to see if you can get it a bit higher. Okay, so the next thing that you can also work on in rehab for COVID-19 patients, definitely what we occupational therapists do, right? Engaging them in your daily activities. Even if it's something as small as giving them a tissue to wipe their mouth or their nose or whatever they are able to do at that point. Okay, I love to engage patients because I want to be able to know what they can do and what level they are at. Okay, if you don't try it, you would never know. Usually my patients will tell me, when I ask my patients to do a certain task, usually they'll tell me, I can't do that, Nancy. You know I can't do that. And I'm like, can you at least try? Because by you trying, then I can kind of see why you can't do it, see what the problem is, and then I can problem solve. But if I never actually see you attempt it, how would I know that you can or cannot do it? You know, so have them do some different small tasks, even if it's just sitting them up and having them reach for a spoon to eat or anything like that, that will have them start to engage in their daily activities. What you're going to do with the patient will be based on where the patient's at as far as strength and endurance and all of that. Okay. Another thing that you can work on the patients is definitely education. Educate them about diet. Okay, this is a really good time for them to increase their intake in fruits and vegetables. Okay, a lot of immune boosting foods. This is the time for them to incorporate that into their diet. So you can also definitely talk to the dietitian about it, talk to speech about it, and then kind of collaborate on different things that you can kind of come up with, like even if it's like a meal plan or something for that patient to help them kind of get better and heal a lot faster. Another one on my list that I think is important that we should not ignore is definitely the mental health of the patient. A lot of these patients have been through a lot in these couple months, and a lot of them are going to go through some sort of PTSD. A lot of them are going to go through just a withdrawal in a lot of ways. Some of them have been literally on their bed for probably 2 or 3 months. So talk to them about their mental health. Some people have also lost friends, and other patients have lost their patient friends, and so this is the time for you to talk to them about their mental health a little bit. And if you feel like there's something that you cannot do, definitely get a psych person in there for them to evaluate them if you feel like they need a lot more help that you can give. But definitely, you know, giving them some encouragement, motivating them. You can definitely work on some coping skills with them. Yeah, I just don't want us to just, you know, focus so much on the physical that sometimes we forget the mental, and they both work together. We need the mental and the physical. We actually need the mental in order for the physical to work at its utmost best. So make sure that you don't forget the mental health as well. Make sure that you guys check out this video right here and also this video right here. Make sure that you subscribe, like, okay, and yeah, that was it for the video. Thank you guys so much, and I will see you in the next video. Bye.